I was warned of the side effects of my treatment before I went in, because I knew, because I had a stage T3B, they were going to take the nerves. So it was a non-nerve sparing radical prostatectomy. So I knew that, you know, I would have erectile dysfunction. What I didn't know, and I was, that I was going to be incontinent. And that was the worst. And I remember having the catheter removed and it was just pouring out. I turned to the urologist and said, I thought I was going to be all right. He said, oh no, this is quite normal. And it took me 3 months of Kegels or pelvic floor exercises to gain control of my bladder again.
But after that's removed, then your body takes over. Your natural reaction would literally stop you from wetting yourself anyway. Although I did wear pads for quite a while until I got used to the idea.
Following radiotherapy, the main side effect I've suffered from is a slight reduction in the control of my bowel movement, so that in the event of needing to go, I found that it becomes urgent.
When I used to go to the gym after the radical prostatectomy, I always did a lot of pelvic floor exercises to try and achieve continence as soon as possible. I was disappointed it took 3 months, quite frankly.
I did lots to combat the problem of bladder control by not drinking too much liquid late at night, especially. Going out, if I had to go out, I had to more or less know where, well, unless you want to use a wall or something. Yeah, I had to pinpoint where the toilets were anyway. And
overcoming the erectile dysfunction problem was a longer process, actually. Viagra and Cialis and all of those were out for me because I had no nerves, so well, they weren't going to work at all. So I looked on the internet and had a look at all the various forms that were around for erectile dysfunction. And the first one, and I thought it would be the easiest and certainly the cheapest way to do it, was a vacuum pump. So I tried the vacuum pump, but it just didn't work for me. I didn't particularly like it, and I gave that up soon afterwards. Then I went on to the injection, the prostaglandin injections, which I found okay. I didn't mind doing the injections, but they were so painful. And what I hadn't realized until that time, that the operation and the radiotherapy had affected the tissue and in my penis, so much so that it had become very painful and I'd almost had Peyronie's disease. The next one I found, which is the gold standard for those people who are permanently dysfunctional, is the American Medical Services implant. And in the end, I decided to pay for that and go to the only surgeon I know in the country who actually does it in London and have one of those fitted. And it's been a great success, I have to say.